Hello and welcome to the EduTalk series hosted by Biotone, Biotone EduPartner School Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Sally Spurgeon, a board-certified massage therapist, a certified lymphedema therapist, and a breast cancer survivor. Sally developed the Spurgeon Method with the goal of training therapists to provide relief, recovery, and well-being to clients recovering from mastectomy and clients concerned with breast health. Since 2011, Sally has offered both breast massage training and post-mastectomy massage training. Sally is also a past presenter, July 2023, of an EduTalk on breast massage and breast health, which can be found in the EduTalk library on biotone.com under the EduTalk tab. Let's listen and learn as Sally shares breast trauma and the invaluable role that massage therapists play in recovery. We have a lot to cover, so let's get right to it, Sally. Thank you for joining us.
Thank you.
I will exit the screen and see you on the other side.
Okay, thank you, Danelle. And thank you to Biotone for hosting this. So hopefully everybody can see my screen. I want to say thank you for being here today. We're going to talk about something that's been long overlooked, both in massage training and in broader healthcare: breast trauma, and the powerful role massage therapists can play in recovery. Most therapists come into this profession with a deep desire to help others. Breast massage offers a profound opportunity to fulfill that calling. The difference you can make in someone's life through this work, helping them feel whole, comfortable, and seen, is one of the most meaningful contributions you can offer as a practitioner. This work has changed lives, and not just the lives of clients. Therapists who perform this work often say it changes how they see the body, the profession, and their ability to support healing in very meaningful ways. Breasts are a vital part of our anatomy, but one that's often overlooked until there's a problem. They need attention and care just like any other part of the body. Yet most massage schools teach us to avoid them, and many states regulate or even prohibit breast massage entirely. But with client consent and proper training, a massage therapist can bring health and healing to this part of the body, often in ways that are urgently needed. And in many cases, this area is in desperate need of a breast friend. We also need to educate our clients on the role of the lymphatic system in maintaining healthy tissue. With gentle manual lymphatic drainage techniques, myofascial release, and supportive self-care practices, we can encourage clients to include daily chest massage in their routine to support lymphatic flow and long-term wellness. Not every therapist will feel called to this work, and that's okay. I wasn't at first, but then I got breast cancer, and that experience changed everything. It shifted how I saw breasts, how I saw trauma, and how I saw healing. It opened up an entire new world that I hadn't seen before. Breast trauma comes in many forms. As massage therapists, you have the opportunity to help ease the pain and fear that is more common than many people realize or are willing to admit. And that is powerful, compassionate work. Breast trauma is more common than most people realize, but it's also one of the least talked about. Clients carry these experiences quietly, often believing that discomfort or disconnection is something they just have to live with. But as massage therapists, we know that healing is possible when the body is touched with care, professionalism, and purpose. We are in a unique position to help, not just by relieving pain, but by holding space for emotional healing. And that matters. Because healing from trauma, especially breast trauma, requires more than physical intervention. It takes sensitivity, time, and a safe environment where someone can feel heard and held. It also matters because this work challenges and helps us to move past the stigma that has too often been attached to breast massage. When we treat this area as the essential part of the body, it is with the care and respect it deserves. We shift perception. We show that breast massage is not taboo or fringe. It is healing, evidence-informed, and compassionate care. And most importantly, this kind of holistic approach recognizes the body and mind as interconnected. Touch can not only ease tension, it can soften fear, restore trust, and create the safety clients need to reintegrate parts of themselves affected by trauma. So what is breast trauma? There are many faces of breast trauma. Surgical trauma might come from mastectomy, lumpectomy, augmentation, or reconstruction. These are physically invasive procedures, and they leave not just scars, but emotional echoes. Then there's the physical trauma, car accidents, radiation burns, physical abuse, injuries from falls, and even from sports. These can distort tissue, limit movement, and cause chronic pain. And let's not forget emotional trauma. This could stem from sexual abuse, gender dysphoria, body image struggles, issues with breastfeeding, or the grief of losing a part of yourself. All of these are valid, and all of them affect the way a person relates to their body, especially their chest. This is why your role matters. You're not just working on tissue. You're helping someone re-inhabit their body. You're saying, this part of you matters. This part deserves care. It's also worth noting breast issues don't pause for hard times. During recessions, pandemics, and personal crises, this work continues. And so does the need for compassionate, trained therapists to help people through it. That's the kind of specialist role that not only fills a gap in care, but also creates stability in your career. Because trauma doesn't wait for a better economy, and healing doesn't happen on a convenient timeline. When we make this work visible and treat it like the essential care it is, we remind our clients and the world that breast health isn't separate from overall health. It matters just as much as any other part of the body. It deserves skilled, ethical support, and we are the ones who can provide it. Trauma doesn't only impact the site of injury, it ripples throughout the body. Adhesions can bind tissues, limit movement, and cause discomfort in seemingly unrelated areas. And emotionally, many clients report feeling numb or detached. As therapists, we can help to gently reconnect them, to ease both the physical and emotional impact of trauma. The effects are layered. Physical dysfunction often reinforces emotional distress, and vice versa. Trauma shows up in more than just tissue. It shows up in how clients see themselves. Losing a breast, experiencing abuse, or living with gender dysphoria can fracture someone's connection to their body. They may feel unworthy, broken, or afraid. Massage therapy, especially when centered around emotional safety and acceptance, can help begin that reconnection. The touch we offer isn't just physical, it's relational. It affirms you are safe, you are whole, you're not alone. Pain and dysfunction from breast trauma may not appear at the site itself. Clients might complain of shoulder tension, limited range of motion, or postural imbalance. Our job is to recognize these patterns, gently restore function, and reduce compensatory strain throughout the body. And just as important, we validate their experience. Chronic pain can be isolating. By offering skilled touch and a listening presence, we help our clients reclaim agency and feel seen in their struggle, not dismissed. After trauma, especially surgical trauma, clients may experience a wide range of physical complications that extend far beyond the immediate site. Scar tissue can bind layers of fascia and restrict range of motion. Adhesions may tether skin to underlying structures, creating pulling sensations or limiting mobility. Swelling is common, especially when lymphatic pathways are disrupted. Clients may also report referred pain in the neck, back, shoulders, or jaw, which often originates from compensatory patterns around the chest. In some cases, nerve entrapment or hypersensitivity may develop, and these issues can make even gentle touch feel uncomfortable or confusing. This is where massage therapy comes into its own. Through intentional, well-informed techniques, we can help soften scar tissue, encourage fluid movement, relieve pressure on nerves, and support tissue mobility, restoring function while easing pain. Massage therapy is uniquely suited to support breast trauma recovery. We use our hands not only to treat the body, but to listen, to honor, and to invite healing. When clients feel safe and supported, they can reconnect with parts of themselves they've been disconnected from, sometimes for years. Our work reaches beyond skin and fascia. It offers something that surgery and medication often cannot: a felt sense of being cared for, of being whole again. That's the deeper role we play as facilitators of healing, presence, and reconnection. Why is massage therapy especially effective in this kind of healing? Because of the way we typically work. Our sessions are longer, they're more private, and grounded in a client-centered approach. We have time to build trust, to listen, and to respond. In many clinical environments, clients are rushed, examined, or treated impersonally. But in our rooms, they're touched with care. They're seen as whole people. And it's not just about the setting, it's about the kind of presence we bring. Massage is uniquely healing because our touch is safe, intentional, and often one of the few places a client experiences non-judgmental contact after trauma. We don't just support tissue recovery, we support emotional integration, and for many, that's the missing piece. While medical care is essential and often life-saving, it isn't always designed to be an emotionally supportive environment. Clinical environments can be intimidating, fast-paced, and focused on procedures rather than presence. Massage therapy, by contrast, offers something rare: time to be still, to breathe, and to feel safe in one's body again. In our rooms, clients aren't being examined or monitored. They're being witnessed. We listen, not just with our hands, but with our whole presence. That difference between being treated and being cared for can have a profound impact on someone's recovery. Massage therapy doesn't replace medical care. It enhances it. We work alongside oncologists, physical therapists, surgeons, and mental health professionals to provide whole person support. When we collaborate, we create better outcomes. Massage improves circulation, reduces swelling, and supports scar healing. But it also calms the nervous system and nurtures emotional resilience. These benefits ripple outward, helping clients engage more fully with their recovery. It also builds trust, both with our clients and with the other providers in their care circle. When we communicate clearly, document thoroughly, and respect everyone's scope of practice, we become a valuable part of the healing team. A massage room is often where the armor comes off. Clients may cry, they may go quiet, they may breathe differently. This isn't a failure of the session, it's a sign of healing. The room itself plays a vital role. It's quiet, soothing, private, a sanctuary from a clinical world. But more important than soft lighting or calming music is you. Your presence matters the most. When we show up calm and open, we help clients feel safe enough to let go, to breathe, and to reconnect with their bodies. Our job isn't to fix, it's to witness, to allow, and to support. Safe space isn't just about decor. It's an experience that says you're safe, you matter, you are allowed to feel. You don't need to know everything to begin this work, but you do need to be present, grounded, and willing to learn. Techniques like manual lymphatic drainage, myofascial release, and craniosacral therapy can be profoundly supportive in breast trauma recovery. Scar tissue work, when done gently and with clear consent, can restore mobility and ease discomfort. But tools alone aren't enough. Just as important is your willingness to listen, to follow the client's pace, and to offer touch that's informed by trauma sensitivity. Always begin with the surrounding tissue, the chest wall, shoulders, and arms. Help the body feel safe before approaching breast tissue directly. Trust takes time. This is not a rush, it's a relationship. Many of these techniques you already know. When applied with an understanding of breast trauma, their impact is amplified. Myofascial work frees restrictions, lymphatic drainage reduces swelling, and scar work increases comfort and function. Even slow, intentional Swedish massage can support deep healing. And of course, presence matters. You don't need deep pressure to make a deep impact. Emotional releases and somatic recall are common during breast massage. Clients may cry, become quiet, or share unexpected feelings. This is not something we need to fix. It's something we simply need to hold space for. Emotional intelligence is the ability to stay grounded, aware, and compassionate in these moments. It's being able to recognize your own internal responses without letting them interfere with the client's experience. You don't need to have all the answers. You just need to be a steady, reassuring presence. Boundaries and empathy are not opposites. They are partners in creating safety. Emotional intelligence means being aware of your own reactions, maintaining clear boundaries with warmth, supporting emotional safety as intentionally as physical comfort. Sometimes your calm presence and willingness to just be with someone in their process is what creates the deepest healing. Before commencing this work, it is imperative to obtain consent. Consent isn't just a form, it's an ongoing conversation. When working with breast tissue, it's especially important to be transparent and thorough. Always explain exactly what the session will include, how touch will be applied, and why it's being done. Make sure clients give verbal and written consent and revisit that consent regularly. Trauma survivors especially need to feel in control of their experience. Remember, we work in a profession that is often under scrutiny, especially when it comes to touch and boundaries. Clear documentation, open communication, and respect for state regulations protect both you and your client. In Nevada, for example, undraped breast massage is regulated, so knowing and following your local guidelines is non-negotiable. Ultimately, consent isn't just about legality, it's about trust. It's about giving your client choice, control, and safety, which is the foundation of trauma-informed care. Let's talk about a very real part of this work, legal compliance. Massage therapists across the country operate under different state laws. In some states, breast massage is permitted with proper training and informed consent, and in others, undraped breast massage is restricted, even when the client gets clear written permission for therapeutic treatment. These restrictions are often rooted in fear, stigma, and outdated assumptions, not in science, safety, or client-centered care. That's why it's so important to know your state's laws and to be willing to advocate for change when those laws prevent access to healing. If you live in a state that restricts this work, don't give up. Get involved. Connect with your board. Educate legislators. Share client stories and outcomes. Because when regulations fail to serve public safety or actively block compassionate care, they deserve to be challenged. In the meantime, protect yourself and your clients. Document everything: your consultation, your client's goals, the purpose of the treatment, and obtain clear, informed consent. Communicate with transparency and stay within your legal scope. When done thoughtfully, advocacy becomes an extension of our care. It says, this work matters, and people deserve access to it. By the time a client finds their way to us, they've often had this part of their body touched in clinical settings by surgeons, nurses, medical techs, sometimes many times over. But that kind of touch is different. It's functional, necessary, often hurried, and sometimes painful. In some cases, the client may not even have looked or touched the area themselves since the initial trauma. They may have kept the bandages on longer than needed out of fear or grief over what's underneath. In those instances, you may truly be the first person to touch the area with compassion, with presence, and with healing intent. That moment matters. Our hands offer more than technique. They say, you're safe, you're whole, and you are allowed to feel. This is what helps someone begin to reclaim their body, not just physically, but emotionally. We're not here to fix. We're here to support connection, reconnection. And that's where real healing begins. Starting this work might feel daunting, but you don't need to know everything to begin. What you do need is the right training, a trauma-informed approach, and a willingness to keep learning. Begin by clearly educating your clients. Explain what breast massage is, why it's important, and how it will be done. Breast massage is vital, not just for pain relief, but for maintaining tissue health, preventing adhesions, and restoring mobility and function, especially after surgery. It also supports emotional healing by helping clients reconnect with their bodies. Start slow. Work the surrounding areas first. Build trust. Let your client guide the pace. And don't work in isolation. Reach out to oncologists, plastic surgeons, and physical therapists. Explain how this work fills the gap between surgery and full recovery. You're offering something essential, care that helps clients avoid prolonged medication use or even further surgery. It's not just another technique, it's a path to transformation for your clients and for your practice. Doing this work takes courage and resilience. Many massage therapists worry about being misunderstood or judged, especially when it comes to working with the chest. Others feel hesitant because they didn't receive training in school or aren't sure how to approach this work without crossing boundaries. It's also common to feel the emotional weight of this work. When a client grieves, shares their story, or experiences release, we can feel that deeply. That's human, but it's also where we need to stay grounded. It is their healing journey. We're there to support it, not to carry it, and not to control it. As therapists, we aren't here to fix anyone. We're here to facilitate healing. to offer a safe space, a calm presence, and a therapeutic touch that invites the body and mind to do what they're already capable of, moving towards greater ease. If you find yourself taking on a client's grief or tension, recognize it with compassion and then release it. Breathe it out. Leave it in the workspace. Protecting your energy doesn't mean you're less invested. It means you're practicing with sustainability and integrity. This work is powerful and it needs grounded, supported practitioners. So take care of yourself, seek support when needed, and build practices that help you stay balanced so you can continue showing up fully for the people who need you. I'd like to share this testimonial from one of our clients. She's a breast cancer survivor who came to us after trying everything else. I'd been having pain in my back, neck, and shoulder for several months. I was in a great deal of pain and couldn't even raise my arm anymore. My treatment for breast cancer had ended the previous year, and after almost a year of chemotherapy and radiation, I was looking forward to returning to my active lifestyle, weight training, dancing, hiking, but now I couldn't even lift my arm. I went to 2 chiropractors, 2 massage therapists, a physical therapist, and 2 orthopedic surgeons. Nothing helped. Cortisone shots did nothing. The only thing that helped a little were the pain pills I'd been prescribed, which I didn't want to be taking. And still, I couldn't lift my arm. One evening at my breast cancer support group, I sat next to Sally, the founder of therapy. I explained how frustrated and depressed I was. She said she could help. 6 massage sessions later, with one of the massage therapists at therapy, I regained full range of motion, stopped taking the pain pills, and returned to my workouts and dancing. I am so grateful to have my life back. Stories like these, which always get me, no matter how many times I've heard them, they're why this work matters. When clients feel seen, understood, and supported by skilled hands, real healing happens. So I've talked about pain, trauma, healing, technique, and consent. But at its core, this work is about helping someone feel whole again. You don't need to be perfect, and you're not here to fix. You're here to witness, to support, and to offer healing in a way that's grounded, ethical, and deeply human. As massage therapists, you help reclaim parts of the body that have been ignored, feared, shamed, abused, or grieved. You offer clients a pathway back to comfort, confidence, and trust in their own bodies. You stand quietly but powerfully against stigma, not with protest signs, but with skilled hands, clear consent, and open hearts. This work matters because it fills a gap in care that's too often left unaddressed. It brings breast health into the light, out of the shadows of taboo, and honors it as an essential part of recovery and wellness. When you show up with knowledge and presence, you remind clients, especially the ones who have suffered, that every part of their body is worthy of care. And when you choose to offer this work, you're doing more than providing a service. You're contributing to a shift in how people heal, a shift towards body acceptance, trauma-informed care, and compassionate connection. So thank you for showing up. Thank you for listening. And thank you for being willing to make a difference. One client, one session, one healing touch at a time. I also want to offer my deepest thanks to Biotone and the EDU Talks team for inviting me to be a part of this important conversation. Their commitment to education and healings makes presentations like this possible and helps bring attention to the kind of work that can truly change lives. Please keep the conversation going. Keep it growing as practitioners and keep advocating for the kind of care every client deserves. Thank you.
Thank you so much, Sally. Would you please stop screen sharing so I can see you fully? So everyone can see you fully. Thank you so much. That was lovely
Thank you, Janelle.
and really inspiring as well. I'm sure massage therapists will find it the same as well. There were some chats, and one of them was, are there people in Massachusetts doing the Spurgeon method?
Not to my knowledge at the moment. I've been a little remiss on trainings this year, I have to say. I normally do about 3 a year. But Massachusetts is not, I don't believe I've had anybody come from Massachusetts. If there's enough therapists there willing to or wanting to learn it, I'd be happy to go teach. But at this time, no. I do have a website. It's yournewbreastfriend.com. And there is a practitioner directory there, so people can look up and see where therapists are that have been trained here.
Otherwise, if the therapist gets a group of other therapists together, 10 people would be good, or what would you?
To 8 to 10 would be fine. Yeah.
Okay, wonderful. Everyone, before I finish with the chats, tomorrow you'll receive a follow-up email, and it should arrive late morning, early afternoon. If you do not see it in your inbox, please check junk or spam. In the follow-up email, you will receive a copy of the PowerPoint presentation. You'll receive a link to the recording. Sally has also provided a link to Dropbox, which will have forms and letters and articles that you can reference. And also, I will include the link to her July 2023 archived EduTalk on breast massage and breast health. Another chat was the ABC table, the adjustable breast cup table, and would you recommend using that for this treatment?
So that again would depend on the client's presentation. Most times after breast surgery, the client's not going to be lying prone. So as their healing progresses, that's a great table for them to be lying prone, because they can then lie on their front again. But most of the work we do, the client is supine and you're working the front of the body. So, but in those cases, they can't lie flat immediately after. So if the table tilts up, it's very helpful and much more comfortable. So it sounds great to me.
Now, post-mastectomy, often there are tubes or drains placed. How do you recommend approaching breast massage after that point or after surgery?
Yeah, so immediately after surgery, if somebody's still got the drains in place, I would say, unless you are asked to work on that client by a doctor, not to, because of the risk of infection. While the drains are in place, there's still an open wound. And of course, infection is always the biggest hiccup, biggest fear post-surgery. So that can set a client back a long ways if they do get an infection. And most therapists do not work in a sterile environment. So it's always safer to wait till the drains have been removed and that incision is healed. So typically 2 weeks after they come out before starting the work.
And the wound needs to be healed?
Yes.
Okay, and tubes removed. Very good. Also, as a breast cancer survivor, you had surgery.
Oh, I did.
Yes. What were the steps you took what did you find was available to you, and what led you to the Spurgeon method?
So when I had just opened a massage office when I got diagnosed with breast cancer. Breast cancer was the furthest thing from my mind. I was focused on working with people with spinal cord injuries, and had a whole wheelchair tennis team coming in. I had that was my focus, which was actually lucky because I was working with the upper torso before I got breast cancer. So when I got my cancer, there were therapists in my office that could help me. The type of surgery I had was double mastectomy with immediate expanders placed. So for reconstruction. When you wake up from that kind of surgery, it feels as though somebody has put a steel girder in your chest in place of a bra, only they got it 2 sizes too small. It hurts to breathe. It hurts to move. It is the most uncomfortable thing ever. And I felt what I needed to release that tissue to be able to move again. So I was able to explain to the other therapists at my office what I felt I needed, and they were able to perform the work on me. And thankfully, I felt great. I mean, I felt so much better. To the point where my surgeon asked what I was doing because I was so much further along in my healing than the other patients in her office. And I was like, I don't know, it's just my method I came up with. So she's like, okay, it's the Spurgeon Method, and I'm sending my patients to your office. And that's how it came about. So that was back in 2010, I think. So I've had
that's
14, I
wonderful.
had 14 surgeries altogether. I've kind of been through a few of them. So
Oh my goodness.
I had a bit of experience with this.
It sounds like it. And the work that evolved and was born from
Well, so then
your surgeries is available to help many people. And, uh,
it
you know,
is. We started,
sometimes from something bad comes something good.
absolutely. We started teaching it just generally in 2012. Where we actually, Deepak Chopra's organization heard about what we were doing and sent their spa director um, to get me to come and teach all their medical staff and their spa staff. And we got so much recognition from that. And so many people have been coming ever since to learn the techniques. So yeah,
That's
so it
wonderful.
was, you know, it was a good step on my journey, right? It was getting breast cancer just changed the whole direction of my business.
It sounds that way. Um, well, I don't see any other chats that have come in, aside from many, many, many thank you for a great presentation. And is there anything you have to say in closing?
Just I found that there's a lot of people wanting to know about breasts now, breast tissue, and how to keep them healthy. So I'm creating a small course that anybody can do. So therapists can share it with their clients. It's really geared towards the general population, just informative about what is this tissue, right? We wouldn't exist as a species without it. So we have to take care of it. So there's basically that. So therapists can learn from it, but it's not massage techniques. It's really just information about breasts and breast health. And that I hope to have that next month. I hope that will be done
Oh, wonderful.
on
Wonderful.
the
Well, keep us posted. Keep everyone
therapy
posted.
LV site.
You broke
Will
up.
do.
You broke up a little bit, so I didn't hear that last part you were saying. Was it an email address?
I'm just saying, well, there's a link to the website, therapylv.com.
.com. Now you're frozen.
Oh no.
Oh, you're back again. I know we've had our share of technical challenges today.
We have.
Tomorrow in the follow-up email, all of Sally's contact information will be there. So you will be able to email her for more information. And I'd like to invite you to our upcoming May EduTalks. And for those of you not familiar, we also do the EduTalk Diabetes series. And on May 13th, the EduTalk Diabetes series has presenter Phyllis Cook, and she will be presenting Diet Changes Can Control Type 2 Diabetes. In the archive library on biotone.com under the EduTalk tab, you'll find both the archives for the EduTalk series and the library archives for the EduTalk Diabetes series. And I'd really like to direct your attention there because some of those talks are presented by massage therapists and educators, and the dietitian talks anyone could benefit from understanding how to stay healthy through diet. So join us May 13th when Phyllis Cook is talking about diet changes for can change type 2 diabetes. Then on May 20th, we have Kim Lawler-Cole, and she will present visceral manipulation and the abdomen. And tomorrow, both RSVPs will be open. So please, again, visit biotone.com under the EduTalk tab and you can RSVP there. Also, the links to RSVP to the diabetes series or the massage series will be in the follow-up email as well. With that, thank you everyone for all you do. Sally, thank you so much for sharing this valuable information and allowing people to help their clients through healing, touch, and comfort and environment. Thank you so much.
Thank you, and thanks again to Biotone. Thanks, Donnell.
Okay, take care. Bye, everyone. Thanks for joining us.